Welcome back to County Connection. For this next segment, we are going to be talking about the importance of breastfeeding. And here to tell us all about it is Whitney Horner from Summit County Public Health. She runs the WIC program. Welcome, Whitney.
Thank you.
All right, so Whitney, April is Month of the Young Child here in Summit County, where we celebrate all things related to our little ones in this community. So this is a great opportunity to talk about breastfeeding, which you are an expert in. So let's start off with talking about why breastfeeding is so important, why we're taking some time to talk about it here today. And let's focus first on that baby. Okay,
so benefits of breastfeeding. I think we've all heard a ton of benefits about breastfeeding, and we all hear about how great it is for the baby. Breast milk is fascinating to me. The cells, the hormones, the antibodies, everything that goes into the breast milk is really creating the best nutrition for the baby, and it really helps babies not get as sick as often. So breastfed babies have lower incidences of ear infection, of vomiting, diarrhea, the list goes on when we think about just medical conditions. And so it's really cool to think that you and I as females, if we were to have a baby, everything that we've ever been exposed to, like the cold, the flu, X, Y, and Z, we're building up antibodies and we pass that into our milk. So it gives breastfed babies mom's line of defense. So they're actually getting the immunity from mom as well. So it fights against disease and infection, which is awesome. It's the perfect food. Babies can be exclusively breastfed for 6 months. They don't need anything else other than breast milk, which is pretty incredible because they can grow and thrive, and your body as a woman can make the perfect milk for your child, and they don't need anything else in those beginning stages.
Awesome.
It's free. That's awesome. Huge benefit. Breastfeeding is really good for our environment when we think about bottles and packaging for formula and X, Y, and Z. Mom can make her milk without all of the extra bells and whistles, so it's good for the environment, it's good for baby, and it's really good for mom too. So I can go into that.
Let's talk about that, because I think that you're right. We do hear definitely that it is great for babies, but there are some really great benefits for mothers as well.
Yeah, I don't think we talk enough about how good breastfeeding is for mom. We always are focused on the baby, and when mom has a baby, she becomes so-and-so's mom and not herself anymore. But breastfeeding, we hear that it helps us lose weight. It affects everybody differently, but we actually burn more calories as women making the milk for our children than we do growing the baby. Our calorie needs are higher when we're breastfeeding than when we're in our second and third trimester, which is a pretty cool thing to think about. Moms who breastfeed, we see lower incidences of breast cancer, ovarian cancer, type 2 diabetes, so there's health benefits for them as well. And then the hormones involved with breastfeeding are incredibly powerful. Oxytocin is going to be secreted when we breastfeed, and it actually helps mom heal after labor and delivery. So it helps our uterus contract, and postpartum bleeding is shortened when we breastfeed, related to the hormones that we produce when we produce our milk.
Wow.
It's pretty cool.
Yeah, that is pretty cool. So we do know that now breastfeeding is important and so beneficial, but that doesn't necessarily mean that it's always easy. So what are some of the challenges that women and infants run into?
Totally. I think there's this common misconception that breastfeeding is natural and we all know what we're doing, and there's a maternal instinct that kicks in that's like, hey, I should know what I'm doing. But for first-time moms that have 6 kids, every kid is different, and so it's a learning curve. And I think moms need to be kind to themselves, because we think that, hey, I got this, which you do got this, but it's a lot of learning, and every baby's different. So I think it's just coming back to the #1 rule always is feed the baby. And I think sometimes women, we get very hefty goals, like I will do it this way or I will do it that way, and we have all of these things lined out, and we have to be kind to ourselves, and we know we feed the baby and that we do it the best that we can. And if breastfeeding presents challenges, ask for help. That's why I have a job, so come and see me.
Let's talk about your job. So, so for women who do have a baby and they feel like they need a little bit or a lot of help, what do you offer?
Yeah, so I run the WIC program over at Public Health, and that's actually an income qualified program for women, infants, and children up to the age of 5. What a lot of people don't know about WIC is how much breastfeeding support we offer. So anybody in the WIC program gets unlimited access to a lactation consultant. We offer breast pumps. We do one-on-one consultations, and we really just do a lot of educating on how to make breastfeeding work. And then being in Summit County, we're incredibly fortunate with public health in that we offer free breastfeeding support to anyone in the county that needs help. I think all moms kind of need somebody to turn to and ask questions for. And at Public Health, we do offer breastfeeding support as a free service to anyone, which is very rare to come across. So we have a lot to be proud of.
Excellent. Yes. Our public health department rocks.
We're pretty cool.
Yeah. All right. So Whitney, if people are looking to get in touch with you for support with breastfeeding or any of the other great services that you offer, how can they do that? Yeah,
so we have a Summit County WIC, we have a Facebook page, we have a page on Public Health where all our contact information is. Great time for my name, email, and phone number. All of those things just go directly to me, and really I kind of take pride in specializing in food and boobs. There's a lot of nutrition and breastfeeding questions, so blow up my email, call my phone, and at Public Health, we're really just looking to help, and we want our children to grow up healthy. So if there's any way that we can answer questions or provide support, we want to do that.
All right, fantastic. Well, thanks for your great work, Whitney, and thanks for coming in today.
Thank you.
All right, we're going to take another break, and when we come back, we'll take you behind the scenes at the Summit County 911 Center.